Hello and welcome to HCS. Approximately 7 million people around the world die from heart attack every single year. And cardiovascular diseases, which causes the heart attack and other problems like strokes, is the world's leading killer. So what causes heart attack? Like all muscles, the heart needs oxygen, and during the heart attack it can't get enough. Fatty deposits or plaques develop on the walls of our coronary artery. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques rupture or crack, a blood clot will form around in minutes, and a partially clogged artery can become completely blocked. This can cause a blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood as well, and the rhythm might be thrown off. In the worst case scenario, a heart attack can cause sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain caused by oxygen-depleted heart muscle. Patients often describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen. But it is not always sudden and dramatic as in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and elderly. For them, weakness and tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affect the nerves and the carrying pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. And if you have access to emergency medical service, call them, because they are the fastest way to get to a hospital. And taking aspirin, which thins the blood, and nitroglycerin, which opens the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity and a blood test to assess heart muscle damage. The patient is taken to a high-tech cardiac suite where the tests are done to locate the blockages. Cardiologists cannot reopen the blocked artery by inflating it with a balloon in a procedure called angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery open. More extensive blockages might require coronary artery bypass surgery using a piece of vein or artery from another part of the body. Heart surgeon can reroute blood flow around the blockage. These procedures re-establish circulation to the cardiac muscle, restoring heart function. Heart attack treatment is advancing, but prevention is vital. Genetic and lifestyle factors both affect your risk, and the good news is that you can change your lifestyle. Exercise, a healthy diet, and weight loss all lower your risk of heart attack, whether you have had one or not. Doctors recommend exercising a few times a week, doing both aerobic activities and strength training. A heart-healthy diet is low in sugar and saturated fat, which are both linked to heart disease. So what should you eat? Lots of fiber from vegetables, chicken and fish instead of red meat, whole grains and nuts like walnuts and almonds. All seem to be beneficial. A good diet and exercise plan can also keep your weight in a healthy range, which will lower your heart attack risk as well. And of course, medication can also prevent heart attack. Doctors often prescribe low-dose aspirin for those who have had a heart attack before and for those known to be at high risk. And drugs that help manage risk factors like high blood pressure, cholesterol, and diabetes will make heart attack less likely too. Heart attack may be common, but they don't have to be inevitable. A healthy diet, avoiding tobacco use, staying fit, and enjoying plenty of sleep and lots of laughter all go a long way in making sure your most important muscle in your body keeps on breathing.